We are joined now by Victor Sutton, Director of Preventive Health at the Mississippi State Department of Health. Victor, thank you for being with us on At Issue. Why is Mississippi so obese?
Wilson, it's a very complicated issue. There's a number of different issues of why Mississippi are faced with the challenges of obesity and overweight that we deal with. It's the foods that we eat. It's the rural nature of our state. It's the access of fresh fruits and vegetables that's available with a number of food deserts that we have around our state. And it's our inactivity that we have, sedentary type lifestyles, and those opportunities to be more active around the state. So there's a number of different issues that impact our state.
We hear that phrase a lot, food deserts. What exactly is a food desert?
A food desert pertains to where you live and reasonable access to get to a place to purchase fresh fruits and vegetables around in your particular community.
Like a grocery store. The proximity your proximity to a grocery store.
Correct. So those are some of the issues that we face where we have a number of different food deserts located around the state.
And so the idea is to figure out how the folks who live in those so-called food deserts, can get to a grocery store, or how you can get a grocery store in their community, or perhaps both?
Great question. It's twofold. It's both. There's opportunities in those places to look at how can communities attract grocery stores to locate to various rural communities, and those opportunities for the grocery store to make money and to offer incentives to attract the grocery store there. And then there's some other approaches looking at opportunities for farmers markets and the establishment of farmers markets in various communities and making those available.
And ultimately, perhaps making some money for somebody in the process is not a bad addition to that. How exactly is obesity defined?
A good question. When we talk about obesity, we're usually talking about a BMI that's over 30.
Body mass index.
Body mass index. And overweight is considered somewhere between 25 and 29. Body mass index is a calculation that's standard across the country, and it's a calculation of what's your height and your weight. And it's a calculation that's gender specific for men and women.
So, are there differences between men and women, or even racial differences, or differences among different income levels of people? Who's most obese?
Yeah. Who's most obese tend to be women, tend to be minorities. And so those are just some of the issues that we have around our state. There's a number of factors, such as social determinant factors, that we like to call to assume as it relates to income, as it relates to education, as it relates to, as I mentioned earlier, where you live, geography, and what you have available to you. So we tend to be obese across the board, but we do have various populations and various groups that are disproportionately impacted by some of these issues.
Let's talk about income level. What are the differences you see among different income levels?
We tend to see those household incomes, 15,000, 20,000 below, more predisposed to being obese. Issues around educational level. Those that have less than or equivalent to a high school degree, as opposed to folks with advanced degrees or more education, what have you. Those with lower levels of education tend to be more obese. And this is an issue around poverty, education levels. All tend to be factors as it relates to those individuals who are obese or not obese.
So the less education you have, the less money you make, all seems to indicate that you're more likely to be obese. How do you get to those folks? What do you do once you get to them to turn things around?
Yeah, we try to do what we call a culture of health, and that's what we're trying to approach it, because it's a very complicated issue. There are factors that some folks are predisposed by genetics. By their parents. If they had two parents that have been obese, there's a strong likelihood that your kids may be obese. But we also understand that your genes, your genetics, your genes don't affect your gene size, perhaps, and that's what we always kind of say. That in of itself doesn't really determine, but that is a factor. You look at issues around your community. where you live and those opportunities that's available to you, as we talked about, being more physically active, being able to purchase and secure fresh fruits and vegetables, and the other issue, Wilson, is being able to afford them. We often know that when you're eating out, that sometimes it's more expensive to eat healthy, as opposed to going to a corner store or going to a fast food and getting what's on the value menu.
And if you have a farmer's market nearby, you might not be able to use your benefits card to go, or food stamps as they were once known, to go and buy those items that might be better for you. So is there a way to help those folks be able to accept that form of payment?
Yes, we've been working with a number of farmers markets that helping them to be able to go through the process to use your EBT card, your food stamp card, as we call EBT card, to purchase fresh fruits and vegetables. A lot of farmers markets don't have that capability. And so if we can remove that particular barrier and work with farmers markets where they're established, help establish farmers markets where none are established, it really goes to trying to make that healthy choice the easy choice. And that's one of the things that we try to do. We've got to make the healthy choice the default choice, the easy choice to make. You need to be able to go into restaurants and take a look and see what's available and what's on the healthy menu and let that jump out to you. Working with corner stores, and we talk about corner stores, we're talking about the stores where you go in and you buy your chips and stuff. Convenience stores. Where there may be some healthy options in there, but they're not just intuitively obvious. And so we're working with stores to try to have a healthy section, and so that those things jump out at you. And you may notice around Mississippi where you're seeing those convenience stores selling bananas and apples and some of those kind of things. And so that's kind of catching on.
Isn't it a tough fight against the value meals and the upsizing the sugary drinks and that type of thing? I mean, that's so front and center in advertising and marketing and everything else. And at the same time, you're trying to preach the opposite in a lot of cases. Does it seem like an uphill battle sometimes?
You know, you make a great point, Wilson. There are big bucks in marketing. And so, you know, when we're trying to promote this message, you're going against major corporations that have this down to a science and marketing to individuals of all race, socioeconomic background, and different parts of the country, in speaking to them and advertising to choose some of these items. We do feel like we're gaining some ground. I think there's been great pushes from the state, from CDC, the Centers for Disease Control, and others with marketing campaigns, understanding the value of living healthy and adopting a healthier lifestyle.
The marketers and the advertisers obviously have a lot of money to put behind their campaigns. What kind of money does it take for you to get this word out, and what kind of support do you get monetarily on the state level and on the federal level?
We most of the dollars that we have in my particular office are federal dollars, and so we compete nationally for grants to do programs, to promote evidence-based type activities, to try to help make the healthy choice the easy choice, to try to put programs in place to change this whole culture of health. And we work in change this culture of health by working with faith-based communities as it relates to health ministries and what they can do at the church. No fried chicken Sundays, churches having walking clubs, churches having screenings, working with work sites to understand the value of healthier employees and what that means to the bottom line with the private sector. They're doing some amazing things around the state, providing clinics in work sites, having a focus on healthier employees, because we know healthier employees tend to be more productive. They take less time off work. Bottom line with workers' comp, they pull less from the health plan. And so there's a number of different benefits for employers to invest in their employee around health. Working with the community, working with mayors. We do a lot with mayoral health councils, understanding that the mayor in their seat has an opportunity to really impact their community. Not only just employees of that particular community, whether it's healthy vending options, whether it's a number of different initiatives as it relates to their particular community. When we talk about walking communities, providing bike trails, walking trails in their community, and understand the benefit of those things. And as we talk about facilities, where in a lot of urban areas in Mississippi, or what we call urban, there's access to gyms and there's access to fitness places. And in a lot of places around our state, there's not access to those things. But working with schools and talking about shared use agreements, there's opportunities to open up those schools to that particular community.
And you're talking about for the community to come in and use this tax-funded schools, playground facilities or workout facilities for their ball teams, that type of thing, where the community could come in and use those facilities.
Correct. We call those shared use agreements. And what it is pretty much a partnership between a school and an organization, a school and a community, a school and another group to open up their facilities. Again, there's a gym with schools, there's a track, there's green space for kids to play on fields and those kind of things. And those are facilities that we have in our communities where we may not have workout facilities and there may be a cost or those kind of things. Those things are available. They oftentimes provide a safe and healthy place to exercise for you and your family and those kind of things, and they're located all over the state. So it's a real prime opportunity to increase and promote physical activity and to decrease physical inactivity.
So if someone out there is watching and knows there's a school nearby that gets locked up in the summertime and they'd like to make use of the facilities, should they call the health department to find out how to reach one of these agreements?
You know, I think that's a great question. I think it's twofold. You can call the health department. You can reach out to the Office of Preventive Health, and we can start initiating contact because it's a process. And then there's oftentimes contacting the school and see what's available. There may be some things in place at certain times that the community may or may not be aware of. There's also a number of school health councils that's located around the state. School health councils looking at opportunities to make their school healthier and providing healthier options at ball games and those kind of things, and really providing some choices where in the past the choices always have been unhealthy choices.
What kind of reaction do you get from people who are obese?
You know, you get a number of reactions. Sometimes you get, to be quite honest, you get some despair, some shame, some I want to address this issue, but I don't know where to start. And so you get a number of issues, and then you also get issues of folks that you would think are healthy, and weight is just one aspect of being healthy. There's a lot of aspects of being healthy, but you get a lot of a mixed reaction. And just like I mentioned earlier, it's a very complex issue that has some individual responsibility, as well as that we're only healthy as some of the choices that we have available to us.
You say it's complex, but is there some magic solution? Is there some perfect combination of whether it's, you talked about eating the right things or exercising? Do you need to do both? Does it vary depending on the person? What's the final solution here?
You know, I think that's a great question. It is a complex issue, and there's no magic pill, there's no magic bullet that you can kind of put into play just to address the issue. It's an issue that, you know, you look at that it's a combination of things. One is, you know, if you're going to intake food, you're going to have to expend that food through some form of exercise. If you eat less, then you have less that you have to expend. So it's based on you and what works and what's your physical abilities and limitations. That's why we always promote walking. That's usually an exercise everybody can participate in, no matter what your fitness level is, as it relates to someone who goes to the gym and enjoys lifting heavy weights, or someone who does not enjoy doing those kind of things, or for some reason does not want to go to the gym or can't afford the gym. But we all can walk, and we can get out into the community to walk. We can go places and walk, and we recommend 30 minutes a day of just moderate physical activity. There's some things called small steps, big rewards. We go to buffets, and you don't feel like you're getting your value that you've eaten all you can. You pile it up. So there's simple things as far as taking the stairs at work as opposed to taking the elevator, parking We look for the closest parking spot
Right.
when we go to the mall or to the grocery store. So there's nothing wrong with parking far away and walking to the grocery store and walking back. And we call it and putting less on your plate. So instead of piling that up, eat a smaller portion size, because we have been conditioned to eat till we just not satisfied, but eat till we just can't eat anymore. So there's some what we call small steps that can yield big rewards.
Especially as you add them up over time, and lots of trips to the grocery store and lots of trips up and down the stairs. You spend a lot of time studying numbers and looking at data. What do you see as the trend moving forward?
Unfortunately, we have not been trending well. We've been in one of the states that's been in the top first or second place for quite some time now, as it relates to the prevalence of obesity in the state. But we're optimistic as a state, as one of the partners in addressing this issue of obesity, that we're going to trend well, and we have some great things in place that's going on all around the state. Great things in it, and we didn't get here overnight, and so it's kind of like turning a big ship around, and it takes a little time to turn that ship around. But I think we're trending in the right direction, Wilson.
Well, if we don't go the right direction, if the ship doesn't get turned around, what happens?
Yeah, well, we're gonna continue to, if we don't turn that ship around, we're gonna continue to have issues as it relates to obesity. Obesity being a risk factor for a number of chronic diseases, as it relates to heart attack and stroke, as it relates to diabetes, as it relates to arthritis, as it relates to some forms of cancer. So if we don't get this under wrap with obesity and deal with these issues as it relates to physical inactivity and nutrition, and this obesity issue, we're gonna see a lot of issues as it relates to the cost that's happening on our state.
Victor Sutton, Director of Preventive Health at the Mississippi State Department of Health. Thank you very much.
Thank you.